Good morning, everyone. I'll be going to present on tooth preparation for full veneer cast metal crown. Full veneer crowns are the most retentive of the veneer preparations. It is the preparation of choice for those teeth whose restoration demands maximum retention. The selection of full veneer crown becomes mandatory when the abutment tooth is small or when the edentulous span is long. They are usually used when less extensive and less destructive designs have been considered. The terms full veneer, full crown, full cast crown, and complete crown can be used interchangeably with full veneer crown to describe a restoration entirely made up of cast metal. Now, definition according to the glossary of prosthodontic terms, full veneer crown is described as a restoration that covers all the coronal tooth surfaces, that is mesial, distal, facial, lingual, and occlusal. Now, rotary instruments used for full veneer preparations, round end tapered diamond. It is used for placing depth orientation grooves, occlusal reduction, and functional cusp. Then torpedo diamond used for axial reduction and chamfer finish line. Then short needle diamond used for initial interproximal axial reduction in posterior teeth. Long needle diamond used for initial interproximal axial reduction in anterior teeth. The small wheel diamond used for lingual reduction in anterior teeth. Tapered fissure burr, that is 171L burr, used for placing seating groove, proximal groove for posterior teeth, then smoothing and finishing, occlusal and incisal bevels. In tapered fissure burrs, 169L and 170L burrs used for initial groove alignment, angles of proximal boxes, for smoothing and finishing, and for placing occlusal and incisal bevels. Then end cutting burr used for conventional shoulder finishing. Then torpedo burr used for axial wall finishing and chamfer finishing. Flame burr used for flare and bevel finishing. Now, full veneer crowns can be of three types, that is all metal, porcelain fused to metal, or all ceramic. Now, complete cast crown, the indications include on teeth that exhibit extensive coronal destruction, on non-aesthetic zone teeth with extensive restorations, then short clinical crowns, retainer for a long span fixed partial denture, on endodontically treated teeth to support removable partial denture where necessary contours with a partial coverage restoration is difficult, in cases of generalized adhesion where vertical dimension is reduced. Contraindications include if treatment objectives can be met with a more conservative restoration and extensively restored or cariously involved teeth within aesthetic zone. The advantages: greater retention and resistance than a more conservative restoration. Strength is superior to that of other restoration. Permits easy modification of occlusion. Protects the coronal integrity of a natural tooth compromised by restorations. Disadvantages include removal of tooth structure is extensive and can have adverse effects on the periodontium. It is no longer feasible to perform electric vitality testing of the abutment tooth. Then the armamentarium for the tooth preparation includes handpiece, round-ended tapered diamond, 171L burr, torpedo diamond, torpedo burr, short needle diamond, and red utility wax. Now the procedure of tooth preparation. First of all, the occlusal reduction is done. In this, initially the depth orientation grooves are placed with the help of a round-ended tapered diamond burr. 1 mm deep grooves are placed in central, mesial, and distal foci, creating about 1.5 mm of clearance on the functional cusp and 1 mm on the non-functional cusps. Now place these grooves in the buccal and lingual developmental grooves and in each triangular ridge extending from cusp tip to the center of its base. On the non-functional cusp, the groove should parallel the intended cuspal inclination. On the functional, it should be slightly flatter to ensure additional reduction of the functional cusp. Occlusal reduction consists of removing the tooth structure remaining between the orientation grooves. It is done in an inclined plane pattern following the cuspal contours. Then is functional cusp bevel. Place depth orientation grooves for a functional cusp bevel across the facial occlusal line angle of the mandibular premolar or molar and across the lingual occlusal of a maxillary tooth. Round-ended tapered diamond is used to give bevel parallel to the inward-facing inclines of the opposing tooth at a depth of 1.5 millimeters, usually forming a 45-degree angle with the axial wall. Complete the occlusal reduction in 2 steps. Half of the occlusal surface is reduced first so that the other half will be maintained as reference. After completing the occlusal reduction, the clearance can be checked by having the patient to close on a 2 millimeter thick strip of red utility wax. There is facial and lingual axial reduction. Alignment grooves for axial reduction are placed with the help of torpedo diamond burr. 3 grooves are placed in each buccal and lingual wall. When grooves are placed, be sure that the shank of the diamond is parallel to the proposed path of withdrawal. When diamond with a 6-degree taper is used, an ideal axial convergence on the preparation wall will result. Gingivally, the resulting depth of the preparation should not be more than half the width of the tip of the diamond, otherwise a lip of unsupported enamel will be created. The facial and lingual axial reduction is carried as far as possible into the interproximal embrasures without nicking the adjacent teeth. While doing axial reduction, cut into the proximal area from both sides until a few millimeters of interproximal area remains. The mesial and distal axial reduction. A short, thin, tapered diamond is worked through the proximal area in an occlusogingival or buccolingual sawing motion, carefully avoiding the adjacent teeth. As you can see, this short needle diamond is used in the interproximal area with a sawing motion, avoiding the adjacent tooth. Once sufficient room is created, the torpedo diamond is introduced to plane the walls while simultaneously forming a chamfer as the interproximal gingival finish line. Then chamfer finishing. All the axial surfaces are smoothed with a torpedo carbide finishing burr, which also will finish the chamfer finish line. Special care should be taken in rounding the corners from the buccal or lingual surfaces to the proximal surfaces. This torpedo burr is used for finishing of the axial surfaces as well as the margins. Then seating groove. The final step is the placement of a seating groove. It will prevent the rotational tendencies during cementation and will help the casting to guide in place. This is the summary. As you can see, all the features which are being incorporated. First of all, the planar occlusal reduction is done, which provides structural durability. Then the functional cusp bevel, it also provides structural durability. Then the axial reduction required for retention and resistance, and a seating groove again for retention and resistance. This is a full preparation for a full cast crown. Now I'll be covering preparation for metal ceramic crown. Now, tooth preparation for metal ceramic crown. The use of porcelain fused to metal restorations has grown from the development of the first commercially successful porcelain or gold alloy restoration by Weinstein et al. In 1950s. The porcelain fused to metal restoration is a combination of an aesthetic porcelain veneering material and a metal substructure. By fusing porcelain to metal, it became possible to produce a full coverage restoration with a stable aesthetic veneer and adequate strength to be used for replacing missing teeth. An anterior metal ceramic crown. Indications include aesthetics, the need to incorporate occlusal or cingulum rest, if porcelain jacket crown is contraindicated. The contraindications include large pulp chamber, then intact buccal wall, when more conservative retainer is technically feasible. The advantages include superior aesthetics as compared to cast gold restoration, and retentive qualities are excellent. The disadvantages include removal of substantial tooth structure, and it is subject to fracture because porcelain is brittle. Then it is difficult to obtain accurate occlusion in glazed porcelain, and shade selection can be difficult. Inferior aesthetics compared to porcelain jacket crown, and it is expensive. Then anterior porcelain fused to metal crown preparation. Again, depth orientation grooves are must. A flat end tapered diamond is first aligned with the incisal portion of the facial surface, and two vertical cuts are made to the full diameter of the diamond, fading out at the break where the curvature of the facial is the greatest. And three similar grooves are made maintaining the same instrument parallel to the gingival segment of the facial surface. Two incisal orientation grooves 2 mm deep are also made. Then incisal reduction. A flat and tapered diamond is used to reduce the incisal edge by 2 mm, keeping the plane of the reduced surface parallel to the former incisal edge. A round wheel diamond may also be used for incisal reduction. Then facial reduction, incisal half. A flat and tapered diamond is used to remove the tooth structure remaining between the orientation groove in the incisal portion of the facial surface. And facial reduction, gingival half. A flat and tapered diamond is used to reduce the gingival segment and extend well into the proximal surface. 1.2 to 1.4 mm is the accepted reduction for a porcelain fused to metal restoration. If there is sound tooth structure interproximally, a vertical wall or wing of it is left standing in each interproximal area lingual to the proximal contact. In lingual reduction, a small round diamond with a head 1.4 millimeters in diameter is used to make 4 depth orientation cuts. A small round wheel diamond is used to create a concave surface over the lingual surface of the tooth, incisal to the cingulum. Then lingual axial reduction, it is done with a torpedo diamond producing a definite chamfer finish line at the same time. If there is limited space between the facio-proximal angle of the wing and the proximal surface of the adjacent tooth, use a long needle diamond to reduce the axial wall lingual to the wing. The lingual axial wall should be parallel with the cervical 1/3 of the facial surface. Then facial axial finishing. Number 171 burr is used to smooth the entire facial surface and round over any sharp angles on the incisal angle or along the edges. In shoulder finishing, number 1.57 burr is used to finish the shoulder. And these are the features of the anterior porcelain fused to metal crown preparation. First of all, the facial margin is shoulder margin, which provides marginal integrity and structural durability, while the lingual margin is a chamfer finish line, which provides marginal integrity. Then axial reduction is done, which provides retention and resistance as well as structural durability. Then incisal notch, again for structural durability, and a wing of the preparation is made for retention and resistance and also preservation of tooth structure. Then we come on to the posterior porcelain fused to metal crown preparation. The first step is again planar occlusal reduction is done using round and tapered diamond and number 171 burr. Depth orientation grooves are made on the triangular ridges and primary developmental grooves. The depth orientation grooves should be 1.5 to 2 millimeters in occlusal areas where porcelain coverage is required. The tooth structure between the orientation grooves are removed following the cuspal contours. Then functional cusp bevel is done using round and tapered diamond and number 171 burr. Depth orientation grooves are placed across the lingual incline of the maxillary lingual cusp. The bevel should parallel the inward facing inclines of the cusps of the opposing tooth at a depth of 1.5 millimeter, usually forming a 45-degree angle with the axial wall. Then depth orientation grooves. A flat and tapered diamond is first aligned with the occlusal portion of the facial surface, and 3 vertical cuts are made to the full diameter of the diamond, fading out at the break where the curvature of the facial surface is the greatest. Then 2 similar grooves are made maintaining the same instrument parallel to the gingival segment of the facial surface. A single depth orientation groove may also be used. Then facial reduction, occlusal half. A flat and tapered diamond is used to remove the tooth structure remaining between the orientation groove in the occlusal portion of the facial surface. Then facial reduction, gingival half. A flat and tapered diamond is used to reduce the gingival segment and extend well into the proximal surface. Then 1.2 mm to 1.4 mm is the accepted reduction for a porcelain fused to metal restoration. Then proximal axial reduction. Short needle diamond facilitates interproximal reduction without nicking the adjacent tooth. Once separation between the teeth is achieved, the needle diamond is used to plane the proximal axial wall. Then lingual axial reduction. A torpedo diamond is used for lingual axial reduction and to round over the corner created at the line angle with the proximal surfaces. Then axial finishing. All the axial surfaces to be veneered with metal are finished using a torpedo finishing burr, producing the chamfer finish line. The facial surface and those areas of the proximal surfaces to be veneered with porcelain are smoothened with the number 171 burr. Now, lingual to the proximal contact, the transition from the deeper facial reduction to the relatively shallower lingual reduction result in a vertical wall or wing of the tooth structure. The shoulder finishing, number 957 burr is used to finish the shoulder and is planed with a sharp 1 millimeter wide chisel. And gingival bevel, flame diamond and finishing burr are used to produce a narrow bevel not wider than 0.3 millimeters. These are the features of a posterior porcelain fused to metal crown preparation for a porcelain fused to metal crown on a posterior tooth. As you can see, this is the facial axial reduction, wherein a shoulder finish line is given for marginal integrity. Similarly, lingual axial reduction is done for retention and resistance and for structural durability, but with a chamfer finish line on the lingual surface, which provides marginal integrity and structural durability. Now, that means the facial surface has shoulder finish line, while the lingual surface has a chamfer finish line. Now, the deeper reduction of the facial surface and shallow reduction of the lingual surface results in a vertical wall or wing of the tooth. This is required for preservation of tooth structure and for retention and resistance. This is the planar occlusal reduction providing structural durability and the functional cusp bevel. And slight amount of gingival bevel is given again for marginal integrity. Now, next is tooth preparation for all ceramic crowns. The all ceramic crown differs from other ceramic veneer restorations because it is not cast in gold or some other metal. It produces the best cosmetic fit of all the dental restorations. However, since it is entirely made up of ceramic, which is a brittle substance, it is more susceptible to fracture. For many years, the only type of all ceramic crown was the porcelain jacket crown. Porcelain jacket crown is built up in increments over a matrix or shell formed by thin platinum foil adapted to a cast or die of the prepared tooth. A lot of recent advances have improved the properties of dental porcelain. However, more than any other restoration, an all ceramic crown depends for its very survival on the tooth preparation beneath. Tooth support is more critical for fracture resistance of the restoration than is the bulk of porcelain. Preparations for this type of crown should be left as long as possible to give maximum support. Over-shortened preparation will lead to stress concentration in the labiogingival area of the crown, resulting in characteristic half-moon fracture. Now, indications for all ceramic were high aesthetic requirement and considerable proximal caries. Incisal edge is reasonably intact, endodontically treated teeth with post and core, and favorable distribution of occlusal load. The contraindications, when superior strength is warranted and metal ceramic crown is more appropriate, significant caries with insufficient coronal tooth structure for support, the thin teeth faciolingually, an unfavorable distribution of occlusal load, and bruxism. The advantages, obviously, it has excellent aesthetics, then good tissue response even for subgingival margins, and slightly more conservative of facial wall than metal ceramic. Disadvantages, reduced strength compared to metal ceramic crown, then proper preparation is extremely critical. It is among the least conservative preparations. It is brittle nature of the material and can be used as single restoration only. Then the armamentarium required for the tooth preparation includes handpiece, then flat and tapered diamond, small wheel diamond, number 171 burr, and radial fissure burr. Now the preparation for porcelain jacket crown. Depth orientation grooves are made. A flat and tapered diamond is first aligned with the incisal portion of the facial surface, and two vertical cuts are made to the full diameter of the diamond, fading out at the break where the curvature of the facial surface is the greatest. Now, three similar grooves are made maintaining the same instrument parallel to the gingival segment of the facial surface. Two incisal orientation grooves 2 millimeters deep are also made. Then incisal reduction. A flat and tapered diamond is used to reduce the incisal edge by 2 millimeters keeping the plane of the reduced surface parallel to the former incisal edge. Then facial reduction, the incisal half, that is 1.2 to 1.4 millimeter. Flat and tapered diamond burr is used. Then facial reduction is done in two planes to achieve adequate clearance for good aesthetics without encroaching on the pulp. Tooth structure remaining between the orientation grooves is removed in the incisal portion of the facial surface. Then facial reduction, gingival half, again 1.2 to 1.4 mm of reduction is required. Flat and tapered diamond is used. Extend the facial reduction through the proximal surfaces with the same diamond, producing a shoulder in the process to reduce the gingival segment and extend well into the proximal surface. Then lingual reduction is done 0.5 to 1 millimeter. A small ball diamond with a head 1.4 millimeter in diameter is used to make 4 depth orientation cuts. A small round wheel diamond is used to create a concave surface over the lingual surface of the tooth incisal to the cingulum. Then lingual axial reduction, it is around 1 mm. A flat and tapered diamond is employed for axial reduction to prepare the vertical lingual wall. Now blend the reduction of each axial surface with that on the adjacent axial surface. Then axial finishing, number 171 burr is used to smooth the axial surfaces and to round all the distinct positive angles on the preparation. And shoulder finishing, number 957 burr is used for preparing a smoothly cut shoulder perpendicular to the line of force or to the long axis of the tooth. These are the features of all ceramic crown preparation for porcelain jacket crown on an anterior tooth and the function served by each. As you can see, this is the axial reduction required for retention and resistance and structural durability. There's rounded angles. Then the concave concave lingual reduction used for required for structural durability. The vertical lingual wall and a shoulder finish line for marginal integrity as well as structural durability. Then posterior all ceramic crown preparation. First of all, occlusal reduction is done, which is about 1.5 to 2 millimeters. A large round and tapered diamond is used to place depth orientation grooves on the triangular ridges and major grooves. Remove the tooth structure remaining between the depth orientation grooves with the large round and tapered diamond. In the functional cusp bevel, large round and tapered diamond is used to produce depth orientation grooves in the facial incline of the facial cusp. A minimum of 1.5 millimeter of clearance is necessary. Then facial and lingual axial reduction, it is about 1 to 1.5 millimeter. A large round and tapered diamond is used. Depth orientation grooves are made and the tooth structure between them is reduced. The axial reductions are carried out as far as possible into the proximal embrasures. And complete axial reduction, around 1 to 1.5 mm. A short needle diamond is used for proximal axial reduction without touching the adjacent tooth. Interproximal axial reduction is done using round and tapered diamond. Then preparation finishing. Round and tapered carbide burr is used to finish the axial surfaces and the functional cusp bevel. These are the features of a cast ceramic crown preparation for an all ceramic crown on a posterior tooth. As you can see, first of all, occlusal reduction is done for structural durability along with the functional cusp bevel. Then there is axial reduction. Make sure that all the angles are rounded. And the finish line is a shoulder finish line, which provides marginal integrity. Thank you.